Happy Saturday, everyone! Summer is quickly approaching, so we are sending you this replay to prepare you to enjoy your summer vacation without nagging knee pains. Dr. Lauren will share secret, proven solutions to end knee pain and live the life you want. Without further ado, Dr. Lauren.
Thank you, everyone, for attending on this rainy day. I'm enjoying some hot chocolate. I don't know if everyone has their hot beverage as well. And I see Donna has one of her kitties with her, so that's really nice. And I'm so glad to discuss this with you guys. Knee pain is something that affects so many people. I have personal experience with it. I injured myself playing soccer, and it's something that I have to manage every day. Everybody, when they have knee pain, is told, well, it's just a natural part of aging. The more miles you have, the more knee pain you're going to have. And I just can't accept that. And I don't think you guys want to either. That's why you're here. And it's about working smarter, not harder. So I'm going to start by sharing my presentation with you, and it'll discuss how to do that exactly, as well as many other things. Oops, well, that's the end of it, so. All right, so I'm here to discuss simple solutions for knee pain. And it's really just that. It's just about knowing what to do and how to do it. And some of these things you just kind of learn from experience and talking to the right people. Like I mentioned before, knee pain is one of the most common joint pains experienced, and this number is growing. I know we had some practice with typing in the chat, but I'm just curious, how long has everybody been struggling with their knee pain? And are they using medication or braces, or how many injections they've had just to kind of get through their day-to-day life? Give you a few minutes to do that. The only thing is I can't see the chat.
Brian says 1 year.
1 year. Oh, yeah.
He's been working diligently at that. Anybody who is, we'll do auction style. Who can beat 1 year? Anybody 1 year? 33 years, 2 months, 2 years. I think Missy's got it already. Decades. Okay, decades could be more than 33 years. Tried everything: injections, PT, massage, ice.
Yeah.
Good. Yeah. So could be a long time. When you think about it, it really could change the trajectory of your life, right? Are you able to go on, the vacation of a lifetime? Are you able to participate with your kids or your grandkids? Are you able to do these, active events, which give you that sort of boost of confidence and everything? So yeah, anything that you could do to manage it. Hopefully it doesn't become a long-term problem, as we're hearing that some people have had here.
Yeah, so a lot of good answers, and that makes a lot of sense, because with knee pain, a lot of times people have to ignore it because they need to get on with their day, or they're not sure what to do, and they're told to just take medication, get an injection, wear a brace. It's one of the most common issues that we treat in the office, and it responds really well to treatment. But today I want to talk about simple things you can do right now that will work and kind of address your knee pain now, so that you can do the things that you love. So that's one of the goals of today, is to understand why your knee hurts or why it's so common, provide immediate solutions with these daily struggles because of your knee pain. And I want you to know what you can do to decrease your knee pain, so you can, again, get on with your life and do the things that you love, and literally make your next step easier. To start off, I'd like to discuss just briefly the anatomy of the knee, because it's important into knowing why it's so common that there is knee pain. So the knee is literally the middleman of your leg. It has the hip and the ankle, the hip above and the ankle and foot below. So anything happening above or below the knee is going to make compensations or adjust for it. Also, the knee is a huge weight absorber. It's a big leg mover. You can see there's all these structures in there. So you have these big muscles in the front and there's ones in the back, also in the shin and the calf. It's actually two joints. You have where your thigh and shin bones meet. And then the second joint is where your kneecap rests on top of those two bones. All these bones are covered in cartilage and they help the joint move smoothly if there's no issue with the cartilage. You also have these pads on the inside and the outside of called your meniscus, and they help with smooth movement, but also provide some cushion. And then you also have your ligaments here, and that provides stability for the knee. Move this over. There's some in here. And there isn't a picture of it, but there's also these fluid-filled sacs called bursa that decrease friction. Basically, what I want you guys to understand is there are so many things in your leg that we don't know that's there or take for granted. And so even though there's more things that can be injured or what are causing your knee pain, all of these can respond to some changes. It's about knowing what those changes are. So the first step is with addressing your knee pain is kind of reviewing your day and like a day with your knees and what might be giving you trouble. Again, with the chat, I'm just curious. I listed some major ones that patients tell me when they come into the office, but I want to make sure I answer all of your questions and give you as much advice as possible within this hour. But I do have a babysitter, my husband, with the kids, so I can stay much longer. Whatever you guys need, I'm here for you. So just quickly type into the chat, what are the things that are giving you trouble because of your knees? And if Matthew, if you don't mind reading what those are, since having some technical difficulties.
Running. Okay. I know that there's things, I don't run a lot, but maybe a couple times a week, 3 or 4 miles each time. And, it's something that I have to consistently work on. I can't just assume that, a week or two are going to go by that I don't have to do my specific stretches, my specific exercises for my knee. Fortunately, I'm in the position to know that, but even at some points in time, I'll have that sort of like little sharp twinge where I think I should get an MRI. But fortunately for me, I kind of know what to do, but I can understand someone who doesn't, and they feel that sort of knifing pain that they might sort of end up going down this road of, MRI, medications, injections, and so Peggy says throbbing while in bed, threat of buckling when walking. That is a very real fear. I understand that. Jumping activities, plyometric activities when working out. Dr. Miriam says going downstairs or hills when hiking. It's actually a very interesting one. That's some people are surprised that going down stairs is more challenging than going upstairs. And there's Dr. Lauren will talk about that. There's a lot more load on the knee when going downstairs, and there's ways to improve on that. Marie wears a brace, has a brace and 9 injections. Daphne is concerned about twisting from running or skiing in heavy snow. You're out there on the bumps. That's pretty cool. Ski accident 17 years ago and has a brace and injections since then. So a lot of varied activities here. Very cool.
Thank you for sharing all those, you guys, because that's the thing. It's as Matthew had said, it's about kind of learning what you need to do, and there's again simple things that you can change that will definitely make those troublesome things easier. A lot of people complain about sleeping because of their knee pain. If you are a side sleeper and you don't do so already, I would recommend putting a pillow between your knees. It just puts the leg in a much better alignment. That's also helpful for back and hip pain. However, I do not recommend putting a pillow underneath your knee when you're sleeping. It just puts the knee in a bent position for the entire night. So when you do get up to move, everything's going to be extremely stiff. People also complain about sitting if they're sitting a long time. And I think especially with the past year, everyone has had to sit a lot more, whether they're working from home or just can't get outside. A lot of people ask me how I should set up my desk. Basically, you just want to make sure your monitor is at eye level. The armrests are at a level where you're not having your shoulders up towards your ears. And this for your knee is really important, the hip position. So you should be able to tilt your seat so that you're at a 90-degree angle at the hip. That way your knee is actually in a better position and there's less pressure on the knee. So when you get up to, go do whatever after work or after sitting, it should feel a lot better. Also, just family life is really hard on knees. Dr. Miriam has some wonderful videos that I can include in the follow-up email about just your day-to-day stuff. Whether you have big kids, little kids, grandkids, it's just a lot of getting up and down from the floor. I have an example video link that I'd like to share with you. I'll see if I can do that. I have it right here. Sometimes seeing something rather than talking about it is a lot easier. Okay. So this is just one example. I mean, everybody's an individual. That might not work for everybody, but especially if you have a fall, it's good to kind of know how to get back up again. God forbid if you have a fall. And so that's something that I go over with a lot of my patients. Speaking of getting up from a chair is very challenging if you have knee pain, or it can be. Dr. Michelle has some wonderful videos about not only how to get up and down from a chair, but also walking on stairs, which I'll cover in a little bit. But what you want to think about before you get up from a chair is you want to have your feet flat, your knees apart, and as you push through the middle of your foot, your nose should go over your toes. That way your weight is moving forward. There's less pressure on your knees and it's going to be easier to stand up. Because we've been sitting a lot, I don't know about you and what everyone's watching on Netflix, but I've definitely gone deep into the Netflix and Prime Video archives. But sitting on the recliner couch for a long time, it can be really difficult to get back up. So if you are watching TV or reading, you can move a firm chair into wherever that is, and that will be a little easier to get up from. Or if you just love your recliner and couch, you can place a piece of cardboard underneath the cushion, and that's just going to give you a firmer surface to move up off of. Huge area here, just walking and running, whether it's instability or knee pain, people have a lot of trouble with this. So I wanted to go over just a few things. It's not all inclusive, but some quick suggestions about each one. So on flat surfaces, a lot of times we'll walk with bent knees if we have knee pain, just because that feels a little better, it allows more volume in the joint. However, that's also a more unstable position, and so it's just not as safe. We created a tip sheet as a company or as an office, and it includes some recommendations with walking to avoid this. But basically, you just want to think about where your foot is hitting. You want to hit with your heel. That's going to make you tighten your thigh, make your knee straighter, and you'll actually have a longer step so you can walk faster and with more stability. The same goes with stairs. You want to think about how you're placing your foot. Are you engaging all your muscles? Are you using your trunk to help yourself get up the stairs? If you are really nervous about the stairs and you want to do 2 feet per step, I'm not sure if everyone's heard of the saying, up with the good, down with the bad. So usually there's one leg that's a little more painful or weaker than the other. So when you're going upstairs, you're going to lead with that foot. If you're going down, you want to lead with the painful or less strong or weaker leg. And why that's important is as we go down, all our momentum is being carried down. your thigh muscle, there's a lot more demand on it. So that's why a lot of times when people have knee pain, down is a lot more challenging than going up. With running, you know, in regards to form, I'm not a really big on, you know, whether people should strike with their foot or, you know, their heel or the pad of their foot. But you want to think about what your leg is doing when you're running. Are you hitting the pavement or the, you know, track excessively hard, called shock loading? Are your knees kind of going inward when you have one foot on the ground? These are just some things that cause increased stress on your knees. Oops. Lastly, you want to think about, are there any new things that I've been doing lately or throughout my day? Am I doing something over and over and over, and by the end of the day my knee starts to hurt? For example, of a new thing is if we change up our running shoe or even our daily shoe, because it's going to be spring again. You know, I'm really excited to start wearing flip-flops, but again, because that knee is the middleman of the leg, any changes at the foot are going to affect them. And then also with getting back to exercise, getting outside again, are just that change, or maybe we're doing the same thing over and over, increasing our chance of overuse injuries. Actually, I have a quick question before we move on to the next slide. If anyone didn't have their knee pain, what would be the thing that what's the first thing you would do? I know that with spring coming and everyone hopefully getting vaccinated, people are like, oh, the first thing I'm going to do is this. But in regards to knee pain, what are the first things that you guys want to get back to if you didn't have knee pain? If you just type it in the chat.
Brian says run, play tennis.
I love tennis.
Yeah. Tennis is a
And
great
running.
one for the knees because it is kind of dynamic. You know, there's a lot of three-dimensional movements, lateral, forward, back, turning. And at the same time, you know, as good as it is, if you're not prepared for it, it could be brutal on your knees. So, and this is a key point that Dr. Lauren talked about with the middleman, the knee being the middleman, is you really got to do a lot of work on your ankles, your feet, as well as your hip. So the joints above and below the knee, because when you pivot in tennis, your knee is going to have to do a lot of twisting. And that's not really what the knee is designed to do. Let's see. Adrian says walk in the woods. Yeah, running, walk more, paddle tennis is pretty good. Hard surface, a lot of direction changes, also tough on a knee. But again, it's probably the hip and the foot that needs to be doing more with that. And same thing if you're just, you know, if you're a distance runner. We don't want that hip fatigue that creates that micro torsion at the knee. Same thing with the foot. We don't want the foot falling in where you're creating a what we call a valgus, or a strained position of the knee. So yeah, good. So we'll talk more about that.
So after you've reviewed the things that are bothering your knee and maybe some potential changes there, I'd like to kind of go through my recommended journey in terms of, okay, what are the first things you can do or should do, and then progressing you towards just better overall movement and function. So a lot of people ask me, what should I do? Should I ice or heat? And especially if you've had a recent injury or there's any swelling, you always want to ice first, or use the acronym RICE, which is rest, ice, elevate, and compress. You want to do icing 2 to 3 times a day, about 15 minutes. And even if you just only do that, you'll get a 10 to 15% improvement. Just remember to put a couple layers between you and the ice. Pillowcase works nice. If you're not sure where to put the ice, I would say back of the knee is best, just because there's lots of blood flow there. You can use a bag of frozen peas. In our tip sheet that I mentioned earlier, we have a nice DIY ice pack recipe. Or you can just come by our office. Just let us know you're coming in advance. And I mean, we won't give you just one. We have tons. We'll give you 2. You have 2 knees, so they're great. If you are like me and you don't like being cold, or you feel like you're really short on time, I highly recommend doing an ice massage. I use it with patients a lot, especially on bony areas like the knee and the ankle. At home, you can fill a Dixie cup up with water, put it in the freezer. When it's frozen, just peel away a small layer, and you do little circles like in the picture here around the area where you're having knee pain. I wouldn't do it as long as 15 minutes, just about 5 minutes should be fine. Just kind of making sure the skin is tolerating it well. In terms of alternatives to just general icing that will help with swelling as well as flexibility, we do a treatment called the Graston technique. It's something very special. I have a few instruments here. Basically involves these metal instruments. I don't know if you guys can see. This is the one in the picture. And you have to be specially certified in it. So there's lots of stuff on Amazon that you can search that are, I wouldn't say do this at home. It has to be with a trained professional. But I've just seen people, even if their knee's really swollen, it helps push fluid out. It's really helpful for that initial stage of healing, and also just long-term with improving your flexibility. A lot of people's first steps involve using a knee brace or tape, whether it's they've had an MRI and their doctor or an X-ray and their doctor says, oh my gosh, you're bone on bone, here's an injection, let's brace it. Maybe there's even some advertising targeted at you. I don't know. I have an Alexa, and every once in a while something comes up and I was like, I was just thinking that's really creepy. Or even a friend was saying, oh, here, you can borrow my brace. It's helped my knee. Or if you've had a fall or an unstable knee, I mean, I can relate. I tore my ACL. So for a long time, I wore a brace just out of fear, afraid I was going to hurt it again or fall. Basically, both, whether you use a brace or tape, they both provide stability. However, I think they should be temporary, and you have to do supplemental things with them for them to be effective. And that's why you really should see a PT about this, or at least talk to somebody that's in physical therapy, a physical therapist, because with bracing, it's not a one size fits all. They do different things, so you can determine whether or not you need a brace and which brace would be best for you. Also with taping, there's an image of it right here. You have to have a trained professional show you how to do the right taping for you. And then you have to do extra things with it in order to make the tape effective. My coworker, Dr. Andrew, says this all the time, and it's so true. Motion is lotion and rest is rust. So whenever we have pain or instability or anything with our knees, our default is to feel like we should avoid moving, but that's the worst thing you can do for your knee, because movement is so essential to healing. It lubricates our joints, it increases blood flow, decreases swelling, improves flexibility. And if we're just resting or not moving, all that swelling and stiffness increases. And then again, we have decreased flexibility, which affects how well you move. That being said, movement, it's not a no pain, no gain sort of thing. It's just learning about how you should be moving and what adjustments you can make for your daily activities, and more importantly, exercise. So I'd love to talk about exercise, because this is the whole work smarter, not harder sort of thing. And are you selecting appropriate exercise for your knees, or what adjustments do you need to make to your exercise to make that it safe? So as previously discussed, exercise and movement is just so good for our knees. And it's also just good for our overall health and happiness. And it allows you to maintain a recommended body weight, so there's less compression on your knees. So this is the tricky part. What if you keep trying to exercise, it still hurts? If you're still trying to run and you're like, God, I just can't do it. What's going on? You want to think about, how are you preparing for exercise? What are you doing? Are you warming up? What are you doing to warm up? And what stretching are you doing, if any at all? And what exercise are you choosing to do? And does it include some strengthening? And what cardio options are you doing? And how often are you doing these things? A lot of times it's just about doing less is more sort of thing. Are you doing it so often, the same thing, that we're creating some overuse injuries? So I have to emphasize, it's so important to warm up. We're told this all the time, and same with stretching. But if you're like me, like I feel like I don't have time, this is kind of boring, I just want to get on my run, I only have 30 minutes because, the kids are taking a nap, whatever it may be. But my recommendation that's really worked well for me and for a lot of other people is make your warm up part of your workout, in terms of if you're going on a run, do 5 to 10 minutes of that at a lower intensity. That way you can fit it in and you're really setting yourself up for success and avoiding injuries. With stretching, research says that you need to hold every stretch for at least 30 seconds for 3 sets twice a day, and it has to be every day in order to increase flexibility. You want to focus on your hip flexors, your hamstrings, and calf muscles, and these are tight often because either we're sitting too much or we're overusing these muscle groups. Again, going back to the short on time thing, I highly recommend dynamic stretching. Basically, those are motions that are similar to what you're going to be doing in terms of exercise. Dr. Miriam has a really nice video of some examples of that if you're unfamiliar what dynamic stretching would be. But another example would be for swimmers, if you've seen them do their arm swings, that's a way to kind of warm up the muscles and also stretch them. Another option if you're short on time is, I don't know why this keeps coming up, is using a foam roller or a hypervolt. This percussion massager, this image right here, I have one right here. I don't think there's anything better to improve your flexibility than a hypervolt. I have personal experience with it. I use it in the office all the time. Basically, it uses vibration to increase flexibility of your joints and or of your muscles. And it's very popular among many athletes. I listed here Naomi Osaka, a tennis player. We have Blake Griffin and Lindsey Vonn. I can't say more positive things about it. And we're actually, just for coming on today, we're offering you guys an exclusive link that will be part of this promo for the Hypervolt. You'll get it a huge discount. Matthew's going to put the link in the chat. It allows you to treat yourself and, basically take control of your knee pain. So Matthew, if you don't mind putting that in the chat for me, that'd be great.
Sure, I'll drop that in a second. I will say, especially in this past year, we've seen a huge increase in use of these because gyms being closed. Some people who may have typically gone for massage or even to PT more frequently, having this option at home has made a huge difference. It is, like Dr. Lauren said, it is part of our regular routine too. I use it pretty much every morning just to kind of get myself going. It's not a fad or anything. There's actually a lot of good emerging research on this now. And even though the professional athletes, are using it more and more, doesn't just mean that you should. There is, good research working upon it. In fact, they're using similar type vibration technology for other pain related things too, even in emergency rooms when they're having to give multiple IVs and injections and things. Sometimes they'll sort of get that area going first, and it distracts the brain from the pain. And if the pain's not there, maybe you are able to take those first few steps and start moving better, which will lead to more flexibility, more movement, more strength. Sometimes the hardest thing is just getting going, and this is a great way to kind of jumpstart yourself to get going. So yeah, look, I'll be posting in the chat. We do put this in here just for special events like this. It is honestly, pretty much at cost for us, but thank you for coming on, and we want to get you guys going in the right direction. So this link, if you're interested at all, save the link because this is the only time it'll be in there. So so watch out in the chat bar for that. Go ahead, Lauren.
So once you've established a good warm-up and stretching routine, it's really important to have a good strengthening program too. Like I mentioned before, you have to help out that middleman, that knee, by strengthening your hips. Our hips are stabilized by all the muscles around it, and in turn will provide stability to your knee. I included a few exercise images here. These aren't necessarily all inclusive because everybody's an individual. There's 100 ways to do the same thing. So it's about developing something that's specific for you and your needs, or maybe some version of one exercise gives you pain, but another one that accomplishes the same thing doesn't. So I highly recommend, again, talking to a physical therapist. We offer telehealth visits if you're not ready to come into an office or if you haven't really gone out yet. And that's really a great way to get a consult of what would work for you in terms of the strengthening routine to improve your knee pain. So in terms of other exercise recommendations that I have, you know, a stationary bike, I would highly recommend. I use one as a great cross-training option with my running. It's a wonderful at-home option because it's social distance friendly, and I'm just more, myself and people in general are more consistent if it's just available to you at home. It's allowing movement at your knee with less body weight. If you're having pain doing this, you have to think about, okay, how am I setting up my bike, and kind of like the desk setup, where are my hips and knees and what are they doing? Maybe you need a reclined bike versus an upright bike. Again, these are things that I happily answer for you guys. We're saving some time for some questions at the end. So just kind of hold on to that, or even put it in the chat now and we can address it. Also, think about frequency and intensity of using the bike. If that's the only thing you're doing, then it's likely you'll get an overuse injury. You should be doing some cross training or some stretches with that. If you're new to using a bike, I would recommend beginning with 5 to 10 minutes and then adding a few minutes on each week. Again, it's a great cross-training option for runners, but maybe you don't have access to a bike and you just have a treadmill. A treadmill is okay as a cross-training option just because it's more compliant or smushy than running around on the pavement. However, if you have to or you can't break away from running at all or cross-training, I have to say the Alter-G treadmill is the best way to improve your walking and running and decrease your knee pain. We have one in the office. Basically, it's a treadmill where we can control the amount of body weight. So you're going to have less pressure on your knees and still get the benefits of movement. You don't necessarily even have to have knee pain to use the Alter-G or to benefit from it. I use it with patients with balance issues. I've used it with people where they just want to increase their pace and running. Basically, it also allows you to continue training, whether it's you have an injury or you're just meeting new goals. I don't know, out of everyone out there, if you are football fans, this story really resonated with me. It was on 60 Minutes about 49ers. Now he's on the Chiefs, quarterback Alex Smith. Did anybody see that segment? In the follow-up email, I'll include a link to it because it's really an amazing story. He had a horrible leg injury playing football where he almost lost his leg and his life, but he's back playing football again professionally. And in the segment, part of his rehab was using the Alter-G. It was pretty amazing. Also, I mentioned we have an Alter-G in the office, and whether you're a patient or not, we offer packages if you want to use it or try it out. We're also offering an exclusive link today that will allow you to sign up for a discount if you want a walking or running analysis, and you can try out the Alter-G. And Matthew, I'd love to hear your comments also, what you think about the Alter-G, and if you want to share that link with everybody, that'd be great.
Yeah, I mean, this is a highly specialized treadmill. It's not like just running on any treadmill. The thing that made me invest in it for our clients in our office was not just the understanding that you're taking weight off your joints, but when I got in it, I realized how off my running was. I have some issues with my left hip, and which radiate into my left knee. And I thought it was because I was putting too much weight on my left side. Turns out that I actually run about more than 55% on my right side. And what was happening was I wasn't properly loading my left side to get that kind of rhythmic strengthening equal on both sides. So as every step that I would run, my left side was getting weaker and weaker as compared to my right. And so I was creating more bad habits. I would have never known this had I not tried out the Alter G. And it took, probably a few sessions to realize about how I can sort of even that out. And every so often I do have to go back to it and sort of realign myself. We take our cars for realignments every so often. We sort of need to figure out that alignment on our gait as well. So this is a great tool to do that. I want to go back to the bike for a minute too. In the guide with our proven solutions to stop knee pain, one of the big things that I find with people using the bike or trying the bike and saying that hurts their knee, I actually have great experience with having people turn the intensity up. It's nice to get a little, pain-free motion. That is helpful. But there are times when you turn that intensity up by, maybe 2 more levels, maybe even 3 more levels of what you're sort of starting out to do, that'll actually get those muscles working around the joint, and it actually pulls the muscles, it pulls the joint sort of in position. The muscles want to work. They want to do do what they're designed to do. And if they're not being sort of called upon, they'll just kind of take the easiest way out. So I tell people, anybody with knee pain, the bike is your best friend. But as Dr. Lauren said, it is dependent on what the intensity dosage is. And so, it's a simple machine, but still within it, there are quite a few setup, intensity, and duration type things that, if you need to, we can help guide you through. Marie is asking how long to start on the bike. I would 5 minutes is a great way to do it. Also understand that your activity can be cumulative through the day. If you can do even 3-4 minutes in the beginning of the day, then at lunchtime 3-4 minutes, and then a little bit later on, that's actually probably better than just doing a 1 10-minute stint. Because if you do 10 minutes and then you sit for a long time, or you're sort of even up and pounding on the joint for a long time, you're going to need that little refresher of that full range of motion that you get on the bike. Brian is I just was messaging him here through the chat, and he said he would be willing to kind of come on and talk about the Alter G for a minute, because he's used it quite a bit.
Great.
Where's Brian? Can you unmute yourself? Lauren, can you change it?
Can you hear me?
Yep. There we are.
Yeah. So for me, I had, I'm a big runner, and I had a torn meniscus on my left knee on both sides, had surgery in September, and I started going to Matt for physical therapy in October. Been, seeing them pretty consistently, since then. And I was introduced to the Alter G treadmill, and it was incredible because the great thing about it is I could set my body weight and figure out what the pain level was. So when I first started using it, I was having my body weight at about 60%. And then I slowly progressed and eventually got up to 100%. And it was just great just to, condition the knee, get it ready for, when I was going to go back out on the roads. But just really incredible machine that, before you head back out on the road, you just make sure that you're ready to go back out on the road or any type of activity.
Yeah, that's awesome. And we love seeing you run on there, and we know where you're headed when you're doing your training. So that's pretty cool for us too to see. But you don't necessarily have to be a runner, even if you just have pain with walking. I understand that, the idea for some people of going out and walking a mile, and this is one of our standards of being active, is can you walk a mile in about 20 minutes? That's a 3 mile an hour pace. That's a community pace, we call it. If you can't walk a mile in about 20 minutes, you're going to have to make some changes with the cadence that you're doing. And if that brings on knee pain, then you're going to have to figure out some way to lighten yourself up. Now, the only way to do it that I know is either get in a pool, which is not a real gait process, or alter G like this. Or the other option would be using a cane or a walker. Most people tend, out of vanity, don't want to use a cane or a walker, although it is very, very effective in lightening up the weight on the joint. Most people just don't want to do it. Access to a pool is challenging, and so that's why we've got this option here for the Alter G, and it can take you from walking with pain to, even within the same session, a light jog with no pain within a few minutes, just because we can get very specific on how we can alter your gait and alter the weight on the joints. And then from there, slowly progress you back to your full body weight, and then even get beyond that. So Adrian asks, walk a mile, I can only do a few steps. The more I walk, the more I hurt. Understand. That's I get it, Adrian. That's why we're giving you some alternatives with the bike, as well as possibly ways to unweight with the Alter G. So I'm going to put that link here for the Alter G. You can come and try it out. We're happy to do it. We'll also do a gait analysis to kind of see some things that you can improve. So every step that you take can end up being a step in the right direction.
Yeah, I agree with Matthew 100%. I've used the and Brian, because I've used the Alter G personally, and have various injuries from sports and having kids, and it just has kept me moving in a positive direction. Moving on with other recommendations, again, you want to switch up your routine. You don't want to do the same exercise all the time, and that's a common issue, just because we pick what comes naturally and what's most enjoyable. Also, it just comes down to what's available and what's accessible, and that's been kind of a big tricky thing these days. And so it's nice to kind of talk about these alternatives and how to make it work. If you change up your routine, you're going to avoid overuse injuries and plateaus in your progress, whether that's endurance or strength with walking or running. Cross training is so important, given some of the things we already discussed with the previous suggestions. And you really want to do a different type of exercise at least once a week to avoid overuse injuries. And lastly, it's just a good idea to see a physical therapist. We're direct access in New Jersey, so you don't have to see your doctor to get a prescription to come. If you haven't had physical therapy before, the first appointment, you'll find out what is causing your knee pain. It's not Dr. Google or information from social media. We'll discuss why it's there. And this is the important thing, because if you're not treating the cause and you're only treating the symptom, you're not going to have long-term results. And lastly, not only how you're going to fix your knee pain, but prevent it from coming back. But thank you everyone so much for attending. And I would love to answer some questions. Maybe if I get out of this presentation, I can see the chat again. Some technical difficulties.
So just
here.
go to the bottom and do stop share.
Oh, okay.
Yeah.
There we
so
go.
Marie
That's
asked a good question. This is a very, very common one. After a walk, should I stretch and ice? No pain until end of my walk. So I think that we assume that just going out and walking it's just a walk, right? But there is a toll that your body takes on whatever the intensity is of that walk. So my reply is basically understand that there is a adjustment to intensity that you might do. If you're having pain at the end of the walk, maybe start by shortening up by 5 minutes, and then add a little stretching at the end. So you're going to accomplish two things. You're going to take some intensity off of the walk and see if it's just a dosage thing, and building in that time for stretching, you're definitely going to get some benefit out of the stretching, 100%. Especially if you're not doing any of it. So you can stretch after, of course. We also find that, maybe within the first, after the first 5 minutes of your walk, that's a good time to sort of stop at a bench or just lean off the curb and stretch front steps of your house. What I'll do is I'll maybe do like one loop around my block and then come back and stretch on my front steps and then actually go out for my real run. Brian, in your recovery, we've talked about so when do you stretch? And you say, well, I just go out and run. I've always just run. And that's, typical runner, got to get the mileage in. I understand that. But we're three-dimensional beings. You can't just do that sort of one path thing all the time. So stretching is definitely a big part of it. Dr.
I have
Long,
some
what do you have to say about that?
recommendations as well, just regarding that question. You also want to think about, really break down what is happening when you're walking. Are you walking the same route? I had a patient where we're talking about just some parts of Chatham where I live where the sidewalk is all broken up. So obviously it was bothering her knee because she was walking on all this unstable surfaces, not to mention she was pushing a stroller over it. So of course, we're like, okay, well, we have to think about a place you can walk where it's not as unstable, or maybe if you can walk without the stroller. Sometimes, there's kind of bevels in the road. So one leg is actually appearing lower than the other. So just think about your route. Is it flat, or are there lots of hills? Is it uneven? And also your shoes. Are you always wearing the same shoes? How long have you had those shoes? Or is it time for some new ones just to kind of get a better foot position to support your knee?
Yeah, I think the road camber is a huge thing. I mean, whether I'm just walking, as my wife and I try to do a couple walks a week, and also run together, but some days we just feel like walking. Whether I'm walking or running, I'm in the middle of the road. Not safe for everywhere, of course, but I'm right on top, right in the center, because the minute I go off to the left side, it tends to, really aggravate my hip. And, fortunately, I know the mechanics behind it, but some people may not even realize that that's what's going on. So whenever possible, if you're in a quiet space, no traffic, walk in the middle.
Any other questions? If anything comes up after the webinar, Matthew will share our, link to our website, and it has our phone number. We love talking about this stuff. We're big PT nerds. It's such valuable information. And again, it allows you to work smarter, not harder, or do the things that will get you back to, not having restrictions because of your knee pain.
I have a question that we can sort of pose to the group. What are you doing right now to help your knees get better? Not necessarily in broad terms like physical therapy, but has anybody found anything specific, like a certain exercise or a certain stretch that they've found beneficial? Or would you like to hear more about that today? Dr. Miriam uses Hypervolt. Is nobody stretching? I hope one person is stretching out there. So, yeah, I do stretching and yoga. Wonderful. And, let's see. Yeah, yoga is tremendous. It does. Linda, happy to come on and hear you talk a little bit about yoga, but the yoga is sort of a three-dimensional thing versus sometimes we get into this sort of one-dimensional stretching where we'll hold our leg out straight and lean forward, and we'll grab the typical runner will sort of grab their foot and sort of pull the leg up behind them. You're missing probably at least 50% of what you need with that stretch. And then there's a whole bunch of other things to do too. Linda, you have any good poses for helping knee flexibility you want to talk about?
Can I unmute myself and
Yep,
talk?
there you go.
So this is Linda, and yes, I'm a yoga teacher. I've suffered through knee pain. I had an accident where I damaged my knee, had knee replacement. I've had arthritis in the other knee, had knee replacement. So I've been in all different worlds in terms of knee pain. What I can tell you is the reason why I love yoga is because we focus, most teachers, I do anyways, focus on alignment and being more aware of how you use your body, how you move through different poses, movements, exercises. I'm a stickler about alignment, how you place your foot, that sort of thing. So yoga has helped me tremendously, and that's why I became a yoga teacher.
I think that's a key point that you made about the foot placement. There's a saying in physical therapy, when the foot hits the ground, everything changes. So where the foot is will definitely make a difference on how the knee is positioned, how the hip positioned. Will they be able to stand up to the different ground reactive forces that come up and in through the knee? So that's just slowing it down in sort of a yoga type fashion is key to be able to own those positions and then bring them up and be able to do it real time. So thank you,
The other
Linda.
thing about yoga is people think, well, the pictures in the media feature people who are in pretzel poses. That's not for everybody. We meet you where you are. So wherever you are, we have modifications for everything. Just like in physical therapy, you don't start asking people to run 5 miles the day that they walk in. If they have knee problems, you start small, right? And work up gradually, and you improve as you go. So the other thing I want to comment on, I wrote in a comment in the chat, but maybe you didn't see it. Heel height makes a huge difference. I have found when I injured my knee, when I have the arthritis, and even after knee replacement, heel height affects how your body lands, how your whole body is aligned, where your weight is. So that's an easy thing that you can do to figure out what shoes your feet and your knees feel better in, and how you're adjusting your body to accommodate the different heel heights.
Absolutely. The heel height will sort of set that, imagine like blocks stacked on top of each other. If the heel height is too high, the where those blocks connect at the knee, one's going to be a little bit shifted further forward than the other one, and it's going to really create some wearing in places that you don't want it to wear. So absolutely. Let's see. Donna says she wears a compression sleeve, and Zoom exercise is great that she's doing that.
Daphne had a nice question too. She wanted some quick reminders or demo stretches of what not to do. But the thing is, it's not about it's basically how you do the exercises and why. So, even sometimes people have a hard time with the quad stretch. You can kind of kick into your own hand, and that'll engage the hamstring, and that it takes pressure off your knee so you can do a quad stretch. However, like Matthew said, why are you doing a quad stretch? Not that it's a bad stretch, but it's like, okay, maybe there should be some more like bigger movements, like Linda was mentioning with yoga and stuff. So I'm not a big believer in saying like, oh no, like you can't do that. It's just like, it's a conversation, and it maybe if that particular exercise or stretch isn't working for you, there's alternatives. So it's kind of, it's not as clear cut. Unfortunately, I wish I could just say, yeah, these are the only ones that you'll do and they're going to be great, but that would be a disservice to you.
I agree. We get that question. We get these questions a lot. People will sort of like pop their head in the door. Hey, I need some stretches for my knee. You got any? It's like, well, this is not a fast food place. Like, it's all individualized. So we did give some general recommendations in our guide. I think if you haven't gotten the guide yet, you should have when you sort of went through this registration process. And in there are some links to specific exercises, dynamic warm up, which I think is huge. People often forget that that just movement in sort of a three-dimensional way can be very helpful and important. So we did put some video links and exercises in there, but we explain, in the paragraphs above those links about, why these might work for you and to do them if they do work for you.
Yeah, and again, like I love this stuff. We love this stuff. We're totally open to any conversation. Having knee pain and, not even being able to walk is extremely frustrating, and I can relate. I mean, after I had my son, like my knee was giving out, my leg was giving out. It was so scary. And as I used to play soccer at a high level, and I was like, what is going on? This isn't fair. But it was about learning and knowing what to do. And we'd love to talk about this stuff. So if even we can arrange a phone call or a discovery visit, the thing is, we're problem solvers, and we want to help you guys, whatever that is. So, and again, this is a great start, and I congratulate you guys on taking this initiative, but we want more too. So we want to help you. So you can always set something up, and we'll have some time to chat about your specific problems and solutions.
And we want to make sure that you're finding the right solution, whether it be with us or somewhere else. So you're free to arrange just a no obligation visit, just kind of get you going in the right direction, give you some alternatives. There's one question here, I can't see exactly who it's from. It says, I miss water aerobics at the Y, but have substituted with yoga. So yeah, like finding the right substitute. Sometimes people haven't been able to come up with a different substitute when things aren't available, like the water aerobics, or they're maybe too fearful to go into yoga. And in a one-on-one setting, we can sort of work with you and say, all right, well, maybe you're not ready for a full yoga class, but here's a couple of things that you should do, and here's a couple of things you should watch out for. As an aside with the water aerobics, I do know that that's going to be coming back in a very big way. We took a wonderful tour of the new facility expansion at the Y a couple weeks ago, and it's just going to be amazing. Like, a tremendous new 8-lane pool. They're doing some renovations on the previous pool that you may already know, as well as a huge basketball court. And additionally, there will be some sort of open movement spaces, which is very interesting because right now they have sort of their cardio equipment and their strength equipment and classes, but they don't really allocate space to just sort of move and stretch, which I think is really cool. So definitely going to be a user and of those spaces, as well as guiding people toward that. So one last thing, Peggy Quinn says hamstring curls are about the only thing that makes my knees feel okay. The hamstring is quite a forgotten muscle. We're sitting predominantly for most of the day. The hamstrings get compressed, and when there's compression on a muscle, they tend to lose blood supply. They tend to get tight, lose strength. Using your hamstrings or exercising your hamstrings is an amazing way to just get that knee stability and strength. So, hamstrings, if you don't know what those are the things that are behind your legs. If you are lying on your stomach and you try and bend your knees up, bring your foot toward your backside, and you get a cramp in your hamstring, that's an immediate indicator you need to do some hamstring work. That means you can't even lift the weight of your own foot. And so you definitely need to hamstring, because when you're going upstairs, when you're walking, getting up from the floor, there's 3 parts to that movement. There's the hip, glute muscles, there's the quadriceps on the front of the thigh, and then there's the hamstrings on back. All of them are combining together to take some sort of percentage of the weight to sort of get you moving. If the hamstrings aren't pulling their weight, which we often find they're not, you definitely need to get those strengthened and probably stretched as well. Who's doing hamstring stretching and strengthening? Other than Peggy. Peggy, you, oh, Sunol, okay. We got some people raising their hands. I can't see everybody, but Dr. Miriam's stretching right now. I would say that, as we get off this call, everyone go stretch their hamstrings, put your foot up on the step, lean a little bit forward. The key to stretching is that you're holding it for 30 seconds, no shorter than that. Well, unless anybody else has any other questions or comments or things to share, we both like to thank you guys for coming today. And, if you haven't gotten that guide to the knee pain solutions yet, let us know, because it's really is like we put our heads together and came up with all the things that we tend to say to people with knee pain all the time. And, through our years and years of experience, it's more than just a quick sheet of information. It's almost like a chapter of a book. And there's a lot of, as I said, active links in there, which can sort of take you into that dynamic stretch and warm up, and some other ways to how to progress going upstairs. It's a very useful thing. It's almost like a how to get the most out of your knee type thing. And as I said in the beginning of the call, we will be doing this, month to month, and almost doing a how to on different joints.
Okay, everyone, there you have it. We hope you enjoy your Saturday. There's Dr. Lauren's proven solutions to end knee pain. If you have any questions, of course, reply to the email or give us a call. Or if you know someone who may be suffering with knee pain, send them this video. We hope you enjoy your summer vacation, and this gives you a little bit of relief knowing we're here by your side.